Introduction to Pediatric First Aid. Introduction to the module. If an accident occurs and results in an injury to family, friends, or colleagues, human nature dictates that you will have the urge to get involved and be more than a helpless witness. This urge will strengthen if the casualty is a child or infant. This is why it is important to have at least a basic knowledge of pediatric first aid. Topics to be covered in this module. What is pediatric first aid? Provision of first aid in early years settings. Role of first aiders. Requirements in childcare. Minimizing the risk of infection. Personal protective equipment. First aid equipment. Storage and administration of medicines. Incident recording and reporting. What is pediatric first aid? First aid is the provision of immediate care to a victim with an injury or illness, usually affected by a layperson and performed within a defined skill range. This person is known as a first aider. In other words, a first aider is someone who has been trained and examined in the skills of first aid. To be a first aider, you'll need to master other abilities, including increased empathy and patience. You will also need to change existing procedures, CPR, AED etc., to accommodate a child's frame and requirements. First aid is normally performed until the injury or illness is satisfactorily stabilized, such as in the case of small cuts, minor bruises or blisters, or until the next level of care, such as a paramedic or doctor, arrives. The term pediatric basically covers the treatment of any child who has not yet reached puberty. This also includes infants or babies under the age of 1 year old. As a parent or a responsible adult, being trained in pediatric first aid will allow you to care for the next generation and possibly perform life-saving procedures for a young life. The basic understanding of first aid is that it is the initial treatment given to sick or injured people until they are seen by registered medical professionals. Being a first aider and having the ability to care for fellow employees and bystanders is an admirable skill set and benefits the whole community. But the ability to be able to perform first aid on children and babies takes that skill to a whole other level. Provision of first aid in early years settings. UK Acts are in place to ensure that the appropriate number of pediatric first aiders, emergency first aiders, and basic first aiders are in place at any workplace or premises used by the general public. For childminders, teachers, and other individuals that come into regular contact with children, there are strict regulations that are set up by organizations like Ofsted, Office for Standards in Education, Children's Services and Skills, Department for Education, LEAs, local education authorities, and the Child Care Register. As a pediatric first aider, you would be expected to liaise with appropriate site managers and/or fellow first aiders to make sure that first aid kits and emergency equipment are immediately available, as well as rooms and other facilities, running water, etc. Incident reporting and accident management systems are in place, accident book, etc. Trained personnel are in place at any one time to take care of and treat children. This is especially important in child-centric settings such as nurseries, creches, schools, leisure centers, and any local community center. Role of first aiders. When attending to a young casualty, a pediatric first aider has 4 priorities, summed up by the acronym PAPP. Preserve life. Perform every action you can to sustain the well-being of a child until emergency services arrive. Alleviate suffering, comfort the child on an emotional and physical basis, along with the provision of appropriate pain relief. Prevent wounds from worsening, treat the child's wounds as best as you can, immobilize limbs if necessary, and dress incisions or burns. Promote recovery, be mindful of a child's reaction to shock, and ensure that professional medical services are aware of the situation. As a pediatric first aider, you also have to ask the following 5 questions as to your place of work or premises. 1. What is the risk to children? Is it a public place or a closed environment? Are there exposed machinery, bodies of water, access to high areas, and other obvious hazards? 2. How many employees are around at any time? Take into consideration holidays and sickness. 3. How many first aiders do you need in the area? Think about possible emergencies and the likelihood of children being involved. 4. What accidents or emergencies have previously taken place there? Use this knowledge to understand what equipment and training you may need. 5. What other factors do you need to consider? Are there regular visitors? Do children have unsupervised access? And so on. Requirements for childcare. If you are ever responsible for looking after children that are aged 5 years or younger, you should be part of the Early Years Register. To qualify for this, you need to learn and adhere to all the standards set out in the IFE's Early Years Foundation Stage framework. If you hold any type of responsibility for the supervision of young children, you must have 5 core requirements and demonstrate the ability to uphold these qualities at all times. Those crucial requirements are: you must ensure that a responsible adult is present at all times, and the children are never unsupervised. You must ensure that the children in your care do not come to any harm, either accidental or through intentional punishment. You must be able to manage the children's behavior in an acceptable and appropriate manner. You should never expose the children to smoking, drinking, or drug taking. You must have someone over the age of 18 present at all times. And, of course, there must be immediate access to the skills of a pediatric first aider. Minimizing the risk of infection. The efforts of a first aider to minimize cross-infection is even more important when dealing with children and babies. When treating children, a pediatric first aider must ensure that all medical waste is disposed of responsibly and that they protect themselves, the casualty, and any bystanders from possible contamination. They must also package any used or exposed dressings or bandages in marked medical waste bags, colored orange or yellow. Wash their hands before and after treatment with antibacterial agents. Wear disposable gloves during treatment. Wear other barrier devices if appropriate, face mask, etc. Ensure that they don't directly touch, breathe, or cough over the open wound of the casualty. Cover and dress open cuts, sores, or burns. Dispose of any sharp utensils or syringes appropriately, using hospital facilities. These guidelines are especially important during viral infections or illnesses like tuberculosis and croup. Personal protective equipment. PPE, also known as personal protective equipment, greatly helps protect the first aider and the child from any possible secondary infections or cross-contamination. The items basically create a protective barrier between the casualty and first aider, without affecting the treatment in any way. Examples of this equipment include eye protection, safety goggles or similar, hand protection, nitrile powder-free, or latex-free, disposable gloves, in case of allergies, face protection, pediatric pocket masks, storable and provides protection from blood, vomit, or viruses being inhaled or passed between bodies. The type of PPE obtained will depend on the environment and risk assessment surveys. First aid equipment. Like PPE, the types and amounts of first aid equipment will depend upon the requirements of the company and/or premises, along with the average age and status of the children involved. However, as a bare minimum, a first aid kit should include at least the following items: 20 differently sized plasters, 6 adequately sized sterile wound dressings, 2 large-sized sterile wound dressings, 2 triangular bandages, for head wounds, hand dressing, and arm slings, 3 pairs of disposable gloves, 2 sterile eye pads, 6 safety pins, a leaflet or booklet with instructions for basic first aid techniques. A proactive pediatric first aider will also look at adding other equipment to this range, such as round-edged scissors, wet wipes, a disposable apron and other appropriate items. Immediate access to hot and cold running water should also be considered. Storage and administration of medicines. Along with other considerations, the storage and responsible handling of medications must also be planned by a pediatric first aider. As far as simple storage is concerned, the inquisitive nature and sheer ingenuity of young minds must be taken into account. Never assume something is childproof on a simple face value or because somebody told you so. Make sure that any area that holds a first aid kit or stored medications in the vicinity of children has these restrictions in place. You have the consent of a child's parents to administer any kind of medicine. You have a property or company or personal policy or procedure for safely administering medicine. All forms of medication are stored somewhere that can be secured and protected from a child's viewpoint and attention. Incident recording and reporting. Just like any emergency or accident, an incident involving the injury of a child needs to be recorded and filed by an employer or company. This should involve the use of an accident book. The details should include the name of the child casualty, a description of the injury and first aid administered, the date, time, and location of the incident, the name, signature and contact details of the pediatric first aider, what happened to the casualty following the incident. However, serious accidents involving children usually required an extra layer of reporting, with various other organizations such as Ofsted and HSE, Health and Safety Executive, also needing to be informed. Summary. In this module, we have covered the following points. Pediatric first aid involves the treatment of children of a specific age range. An employer or property owner is legally required to have the necessary number of pediatric first aiders on site at any time. A pediatric first aider has 4 primary objectives when treating a casualty. Child care requirements must be considered by a pediatric first aider, as well as equipment. There may be extra organizations to alert during an accident involving a child.